Good afternoon. I'm also pleased to be part of today's meeting, and also I would like to welcome everybody on behalf of NCDC and also the Global Fund programs in Georgia. So my role here today is to present our integrated screening program, integrated screening of TB, HIV, and HCV in primary healthcare settings, which were introduced and started about a year and a half ago, and I'll present results and some lessons learned under this program. As it was today briefly discussed, mentioned by Dr. Amiran and the other also presenters from Georgia, so Georgia implements elimination, HIV elimination program. So, and together with our partners, the country, we developed a strategy, and we also conducted study, and we estimated how many people are infected in the country, and what is number of population also who needs to be treated under this program. So, but focus today, of course, it's not the Hepatits elimination program. So next slide is a slide which was presented by Minister of Health last year at the Irma conference in Amsterdam, so which presents the steps and the roadmap of Hepatits elimination, which started in 2015 with establishing a great and very important public-private partnership with Gilead and also CDC, Atlanta, WHO, who are our key partners, with many others also in this role of elimination. But what is important here, so at some point when we reached about the half of our target in terms of screening, and 1/3 and a little bit over 40% our target in terms of treatment, so country realized that it's now we need to reach most hard to reach population. So people who don't have any symptoms, and probably knowledge also how important it is to have the preventive screening and detect the disease, and for that to improve access to any services which will lead us to detection, diagnosis and treatment of Hepatits. Decentralization is key. And having this, bearing this in mind, so a series of consultations was happening in the country, discussing what might be ways of decentralization and at the same time integration of different approaches. And to be very brief, so in 2017 we came up with the idea to integrate detection of HCV, TB, and HIV at primary healthcare level, and we started with one of the region, Georgia, which is San region. And the next slide, also this slide was presented last year by a minister at the same conference, where he briefly discussed this approach. We selected a region in the Georgia which has borderline with Abkhazia, where we have the highest prevalence of all three diseases related to HCV, HIV, and tuberculosis. And so we, together with the local government, we set a target to reach in a little bit in half a year, but almost in 7 months, about 40% of the adult population in that region, which is more or less about 90,000, and for this use the primary healthcare network. So what we did, we have the very first step, which was undertaken by NCDC and by the ministry and the local government, was the awareness raising meeting. So we went in each district of that region, and district by district, so educate people, government, local government, public health centers about three diseases, integrated approach, and etc. So we developed integrated screening protocol, which was approved, agreed with the ministry, and also we mapped out service providers, and which helped us later on to build the proper referral systems. So this busy slide defines roles and key responsibilities of different players in this scheme, and I think it's worth to go they briefly describe what are main functions and how it operates. So if start from bottom, so those are primary healthcare district and rural service providers who are in charge of providing active screening to population in their coverage area using rapid test systems for HIV and HCV, and using rapid questionnaire for screening for tuberculosis. So they also are tasked to educate patients, to follow up patients, suggest taking blood tests for the further investigation, and build the proper referral to the next level of care, and the report against their work in integrated information system for HIV and HCV, and in case tuberculosis, so that's fill the referral form. The local government who is involved also in this scheme, so they have allocated budget to support this activity, and this is reimbursed, that's incentive payment provided to rural doctors and district doctors and nurses per screening. And also they've allocated people from their units, so that's first of all health and social unit and public health unit, who were involved in target setting, coordination, monitoring, and also they are in charge of reimbursement provided as a part of incentive scheme to doctors. So Global Fund program provided helped NCDC to design the entire scheme in development of integrated screening protocol, and provided training, and also follow-up supervision on the district level. On the central level, NCDC and Ministry of Health, so that's under the state program, provided test systems, and also with the proper logistics system, and also provided M&E support, maintenance of the HCV screening database, where, as I said, also the results on HIV also entered, and also at the NCDC level, analysis is done of the data received, and also the building all necessary infrastructure for the confirmation tests. So briefly about the results what we have and obtained during the 7 months of implementation of the program, which is April 2018 to including October. So in total 88,000 people were screened, and at the end of the year they reached 95,000 target. And we observe, and to compare, the total number of screened before the pilot, starting from 2015 until April of 2018, 58,000 people were screened in the same region. So we observed over 60% increase in screening coverage. And the detection, so that's before, so about 4,000 people, more than 4,000 people were detected as an antibody positive. And during these 7 months, 3,000 people were detected, and 2,200 under this pilot program. And mostly this program was focused on the rural area. 68% of people who were covered, they live in the rural area, and just 32% in a regional center, which is Tbilisi, and also district centers. And we observed different detection rate for Hep C, 3.25 for in urban area, and 2.25 in rural area. And the population, the age and distribution by sex and age very much really follows the seroprevalence study, which we conducted back in 2015, as I mentioned at the beginning. And the detection rate quite follow also that study. We observed highest detection rate among men aged 30-60, and among women above 60 years old. So this is a care cascade for the 7 months, but it was really very early to evaluate. But anyway, so we decided to have this analysis also in this presentation. So among 2,279 people, so out of this number, as you say, more than 1,200. So they went to the next level of care, and they received the confirmation for active infection, and by October, so that's 500 people, so were on treatment already. So this data relates to HIV. So we estimated, based on our previous experience, doing dual testing for HIV and HCV. So we had 1:3 ratio. And we expected also that that would be this ratio, like more or less the same in that region. Either probably less people would agree to take HIV test because stigma in that region, everybody agrees that it's quite high. However, so almost nobody, I mean, we observed some discrepancy in numbers, and it was linked to shortage of tests because we're not ready, and there is some people sitting from AIDS Foundation who helped us with to really fill this shortage, and thank you again, Zia, for that support. And almost, I mean, everybody agreed to have HIV test as well, and during that period, so we 11 HIV new cases were detected and 10 enrolled on treatment. In terms of tuberculosis, under this program, 22 new cases confirmed and enrolled in treatment, and we have data for 2017, and to compare, just 5 people were detected during entire 2017. So now we're plans are to expand this program in other regions as well. So we have started already in Najara region, in Gurian, in Mereti, and Rajavachumi trainings are underway also in Kaheti, and we will hope that in Kwamukarta we will be able to initiate the program very soon. So and there are the lessons learned. So that's this is the key message, very first one, where we do believe that HIV elimination program really drives public health reforms in the country, and the HIV, TB, and probably other diseases linked to especially having the same route of transmission, and also that services are provided at the same setting, so that they can, those beneficiaries of those diseases will benefit from this program as well. So, and also, our observation is that integration of TB, HIV, and HIV screening in PhD settings decreases stigma, so due to reasons I just described, and decentralization and integration of the 3 diseases services delivered in primary health care can result overcoming barriers to access of care and treatment, and of course, and the right financial incentives, and also non-financial incentives, that was awards and etc., significantly promote performance. And of course, should be program should be expanded even within the country and outside, considering the local circumstances and peculiarities. Thank you.